Hi everyone, we are going to present on capsule endoscopy, arrival to conventional endoscopy, representing group number 26. First, let us know what is capsule endoscopy. Capsule endoscopy is a device which provides visualization of the gastrointestinal tract by transmitting image wirelessly from a disposable capsule to a data recorder worn by the patient, and involves a process that utilizes a tiny wireless camera so as to take image of digestive tract for diagnosis. As we can see in the figure, the structure of capsule endoscopy includes LED, camera, batteries, and RF. Talking about the brief history of capsule endoscopy, Eden et al. First proposed the concept of using a tiny camera as a pill for human GI tract imaging, which was further improved and ended up as a prototype of the wireless capsule endoscope in 1997. By 2000, Gibbon Imaging commercialized the first WCE system, named as PillCam. The product opened an evolution in endoscopy history with the opportunity of monitoring the full length of the GI tract and brought new challenges in identifying the exact locations of the acquired images. There are various types of capsule endoscopes such as microcapsule, endocapsule, PillCam platform, and so on. The PillCam video capsule endoscopy consists of 2 by 11 mm capsule containing the video camera, illumination, and batteries. Among its various types, PillCam video capsule endoscope dominated the market for a few years by itself. Thus, this is the one on which most of the literature is written.
Now let's look at its specification of capsule endoscopy. The diameter of the capsule endoscopy is almost 11 mm. The length is about 26 mm. It is bullet in shape, and the battery shape is usually made up of silver oxide cell. The storage temperature is 0 to 50 degrees centigrade. The operation temperature is 20 to 40 degrees centigrade, and weight is 3.25 gram, whereas the light is 6 LED light is used in capsule endoscopy. Here are the procedure of capsule endoscopy. This procedure involves the ingestion of a small capsule that contains a tiny camera that can take 2 to 4 images per second for 8 hours. It has been specifically developed to view the small bowel. Capsule endoscopy is used to try and pinpoint bleeding in hidden areas in a small bowel. It is also useful for tracking small bowel tumors and obscure abdominal pain. The capsule is swallowed and travels, just like a piece of food, through the stomach, small bowel, and into large bowel. Recording probes tapped onto the abdomen track the progress of the capsule as it makes its way through the gastrointestinal system. The images obtained by the capsule are transmitted to a data recorder worn in a harness around the waist, and after 24 to 72 hours it passes naturally. Implications of capsule endoscopy. Now, what type of disease that can be diagnosed with the capsule endoscopy? Capsule endoscopy continues to improve technically, so it has revolutionized diagnosis by providing a sensitive and simple means of examining the inside of the small intestine. Some common examples of small intestine disease diagnosed by capsule endoscopy include angiodysplasias, which is a collection of small blood vessels located just beneath the inner intestinal lining that can bleed intermittently and cause anemia. Also, small intestinal tumors such as lymphoma, carcinoid tumor, and small intestinal cancer. Crohn's disease, which is also the disease of the small intestine. Also celiac disease. Now in the right hand side we can clearly see the disease named as angiodysplasia, Crohn's disease, and celiac disease. In this video we can clearly see the procedure which involves swallowing of the capsule, and in a matter of seconds it passes to the small intestine, and within 24 to 72 hours of intake of the capsule it passes away naturally.
There are various reasons to choose capsule endoscopy, which includes capsule endoscopy is the most popular technique to examine entire mucosa without surgery. It is also much more comfortable and pleasant without pain and complications to the patients. It is also safe and effective measures to view the colonic mucosa without requiring sedation. It is a good alternative to those patients who are reluctant to conventional endoscopy. Capsule endoscopy also offers greater magnifications, providing excellent resolution.
Capsule endoscopy is a rival for conventional endoscopy. In case of conventional endoscopy, the time duration is longer, whereas in capsule endoscopy, the process of swallowing is far quick to image pass into a stomach in a matter of seconds. It is often required to take a few days off from work for the entire procedure of conventional endoscopy, and there is forbidden for riding vehicles for the rest of the day, while in capsule endoscopy, after ingesting the capsule and having the data recorder, the patients can return to home or work. Capsule endoscopy is also feasible, non-invasive, and safe modern day medical procedures which are not accessible with a conventional endoscopy. In recent years, capsule endoscopy has attracted attention as a medical device that examines the internal digestive tract without burdening the patient. The power transmission efficiency can be improved by knowing the capsule location. For this three-dimensional localization method with 5 antennas can be used. Recently, the development of computer-aided diagnosis system for gastrointestinal bleeding detection in image videos has become an active research area with the goal of relieving the workload of physicians. In the best case scenario for patients at low risk of requiring endoscopy hemostatic intervention, video capsule endoscopy was a preferred strategy in terms of cost and an effectiveness in quality, and dominate all the remaining strategies. Now, after the more than 10 years of approval of video capsule endoscopy, the technology has become an essential component in the management of several clinical conditions. Currently, two capsules are approved for visualizing the small bowel mucosa. One capsule is authorized for esophageal assessment, and several others are in use or under evaluation worldwide. New investigations have focused on optical improvements, advances in intestinal cleansing, and risk reduction strategy to optimize video capsule endoscopy methodologies in clinical care. Established indications diagnosed using video capsule endoscopy include unexplained gastrointestinal bleeding, small bowel Cohen's disease, localization of small bowel tumors, and a broad range of miscellaneous abnormalities. Investigations in future are ongoing to determine the utility of video capsule endoscopy in colon cancer screening, assessment of esophageal disorders, and diagnosis of colic disease. Active research is also in progress in two ways to improve the efficacy of video capsule endoscopy: recording interpretation, prolong imaging time, and further enhance optics and imaging methods. And the references which we used in this presentation are as follows in the upcoming slides.